Hi everyone, and welcome to the Woodland staff training. In today's training, we're going to review the following: new guidelines related to COVID-19. We will learn to recognize a medical emergency, how to obtain a rapid medical response when needed, and know the location of the AED and EpiPens. As a reminder, all staff injuries must be reported to myself or Jeff. If an injury happens and myself or another nurse is not present, be sure to contact Qual Care at 800-425-3222. If you feel fine after an injury, but you decide to seek care later, that evening or the following day, be sure to contact Qual Care to let them know. Do not go to your own physician. Call 911 for all staff medical emergencies. How to properly wear a face mask. As per new protocols, all staff are required to wear face masks while in school. It's important that we are wearing our masks properly to ensure our safety as well as the safety of others. Before putting on masks, we must be sure to wash our hands, preferably with soap and water, for at least 20 seconds. When putting on and taking off your mask, be sure to touch only the ear loops. Do not touch the front of your mask. And after removing your mask, be sure to wash your hands with soap water. Your mask should cover your nose, mouth, and chin at all times. Be sure to wash reusable masks after each use and discard disposable masks after 1 day or when soiled. It is important that we all work together to assess students for signs and symptoms of illness throughout the school day. Signs and symptoms to pay particular attention to include student feeling unusually tired, putting their head down on their desk, flushed cheeks, rapid breathing, coughing frequently or persistently. If you are concerned at any point throughout the day that a student may be ill, please be sure to notify the health office to have the student assessed. Additionally, we are asking that all staff contact the health office prior to sending any student for assessment of illness or injury. This is to help us maintain proper social distancing and to ensure the health and safety of all students. For example, if we are seeing a student that is experiencing COVID symptoms, we do not want a student sent down to the office who's only experiencing a headache. This puts the student at risk and will place the student with a headache on a triage list and call them down to the health office when the prior student has left the office or has been placed in isolation, etc. For any student with minor injuries or ailments, we are asking that they be treated in the classroom. I will supply all teachers with needed supplies such as Band-Aids, lip balm, etc. If you call down to the health office prior to sending a student and there is no answer, please call the main office and they will radio for me. Please do not send the student to the main office. Some common signs and symptoms of COVID are a fever greater than 100.4, cough, chills, shortness of breath, difficulty breathing, fatigue, muscle aches, new loss of taste or smell, sore throat, nasal congestion or runny nose, nausea, vomiting, and diarrhea. Please note that there are many other illnesses that share the same symptoms, such as flu, strep, common cold, and allergies. Post-COVID cough. It's important to note that for some people that have COVID, they may experience a lingering cough that can last for more than 10 days. For mild to moderate cases of COVID-19, there have been no active virus detected on nasal swabs by day 10. This means that by day 10, the virus is not capable of causing illness to others. It is important that we know the difference between isolation and quarantine. According to the CDC, isolation is defined as keeping those with illness away from others. An example is staying in one room. Quarantine is defined as keeping those who may have been exposed away from others. You are considered to have been exposed to COVID if you were in direct contact with somebody who was found to have COVID for greater than 10 minutes. So what do we do if we are COVID positive, are experiencing symptoms, or have been exposed? For COVID positive cases, in order to return to work or school, you must be fever-free for 24 hours without medication. You must show improvement of symptoms, and you must isolate for 10 days since the symptoms first began. An example would be, If you start experiencing symptoms on Monday, September 14th, and you're diagnosed with COVID on Wednesday, September 16th, you must isolate until September 23rd. And you are able to return to work if you are fever-free for 24 hours and have improvement of symptoms. If you are experiencing COVID-like symptoms but are found to be negative for COVID, you must wait to return to work until you have not experienced symptoms for at least 24 hours. If you have been in close contact with a friend or family member who has been diagnosed with COVID, you must quarantine for 14 days. If you are found to have COVID and are asymptomatic, you must quarantine for 10 days from the specimen collection and have no development of symptoms before returning to work. If someone in your household is diagnosed with COVID, you must quarantine for 14 days from the last known exposure. Now we're going to cover student medical conditions. Student medical conditions can be found in Genesis by clicking on the red first aid sign near the student's name. I will reach out to you with specific emergency health plans for students as needed. When should you call the emergency medical response team? If someone collapses, is unconscious, has decreased respirations, if they have experienced a serious injury, seizure, uncontrolled bleeding, difficulty breathing, or a severe allergic reaction. One of the most common chronic conditions in students is asthma. It can be triggered by indoor and outdoor irritants. It can be controlled with medication, but it can't be cured. And approximately 10% of students have asthma. So what is happening during an asthma attack? During an asthma attack, muscles around the airway tighten. The airway becomes swollen and mucus blocks the airway. This then leads to a decrease in air movement into and out of the lungs. Some early signs of an asthma attack might be coughing, wheezing, chest tightness, and shortness of breath. Asthma can be minor or it can interfere with daily activities. In some cases, an asthma attack can be fatal. Asthma is usually managed with a rescue inhaler to treat symptoms and controller inhalers to prevent symptoms. Severe cases may require longer-acting inhalers that keep the airway open as well as oral steroids. Signs of an asthma emergency include difficulty walking or talking, bulging neck muscles, nasal flaring, and difficulty breathing. Call the health office immediately at extension 5503 or the main office at 5500 to request a medical response team. While you're waiting for the nurse or the medical response team, offer the student reassurance and support. If the student is in a lot of distress, limit their movement. Help the student into an upright position. Do not leave the student alone. And if the student self-carries their inhaler, have them take 2 puffs from the inhaler. Some of asthma's most common triggers are strong odors, room deodorizers, essential oils, perfumes, poor ventilation, extreme humidity and weather changes, mold, mildew, and pollen, furry or feathered animals, strong emotions, and exercise, as well as upper respiratory infections. What can you do to reduce triggers? In your classroom, try to reduce clutter, avoid a lot of area rugs, use covered bins for storage, use low odor instructional supplies, have cleaning products approved by maintenance, and report leaks and odors and mold problems to maintenance. Now moving on to diabetes. There are 2 common types of diabetes that we will see in students, type 1 and type 2. With type 1 diabetes, it is an autoimmune disorder and it destroys the cells that produce insulin in the pancreas. Daily insulin is needed for life and it is most common in children and adolescents. It makes up for 5 to 10% of diabetes cases. In type 2 diabetes, insulin is resistant. It is most common in adults, but is increasing in children and adolescents due to inactivity, being overweight, genetics, and ethnicity. Symptoms seen with type 1 diabetes are as follows: sudden onset of thirst, frequent urination, weight loss, fatigue, and blurred vision. The state mandates that glucagon administration delegates for any student with type 1 diabetes. Glucagon is an injectable medication that is used in a diabetic emergency. On the other hand, type 2 diabetes develops slowly. The person may become tired, thirsty, or hungry. Sometimes they may not exhibit any symptoms other than having high blood sugar readings at their doctor's visit. Some patients take daily insulin or medication to help manage their type 2 diabetes. They may be able to manage their diabetes with nutrition, exercise, and glucose monitoring alone. What is hypoglycemia? Hypoglycemia means low blood sugar. Low blood sugar readings would be less than 90 for a child younger than the age of 5, less than 80 for children ages 5 to 11, and less than 70 for anyone ages 12 and older. A diabetic with severe hypoglycemia may experience a medical emergency, including fainting, seizure, and loss of consciousness. It is important to give the student carbohydrates before the blood sugar becomes dangerously low. Some symptoms of hypoglycemia include anxiousness, fast heartbeat, dizziness, headache, irritability, sweating, shakiness, weakness or fatigue, hunger, or blurry vision. Seizures. Report any seizure activity to your nurse and call the emergency medical response team for any generalized seizure. Some signs and symptoms of seizure include shaking, body stiffness, whole body twitching, head drop or twitch, unusual eye movements, blinking, staring off, rolling back, moving left and right, arm twitch, and leg twitch. What to do in the event of a seizure. Stay with the person, time the seizure, protect the person from injury, loosen anything tight around the neck, do not restrain the person, do not put anything in their mouth, roll the person onto his or her side as the seizure subsides. After the seizure has passed, talk to the person reassuringly. Guidelines for managing a life-threatening allergic reaction. School nurses throughout New Jersey have been mandated to provide EpiPen training annually to school personnel in the event of a life-threatening emergency requiring the administration of epinephrine. Trained staff are required Trained staff are referred to as designees or delegates. Any student who has a prescription for epinephrine administration must be assigned to a designee who must accompany him or her during the school-sponsored events such as school activities, sports, or field trips. What to do in the event of a seizure. Stay with the person, time the seizure, protect the person from injury, loosen anything tight around the neck, do not restrain the person, do not put anything in their mouth, roll the person to his or her side as the seizure subsides, and after the seizure has passed, talk to the person reassuringly. Guidelines for managing a life-threatening allergic reaction. School nurses throughout New Jersey have been mandated to provide epinephrine training annually to school personnel in the event of a life-threatening emergency requiring the administration of epinephrine. Trained staff are referred to as designees or delegates. Any student who has a prescription for epinephrine administration must be assigned a designee or delegate who must accompany him or her to a school-sponsored event such as school activities, sports, or field trips. Life-threatening allergies. Currently at Woodland, there are 14 students with severe food allergies. Most common food allergens are nuts, dairy, eggs, fish, and soy. Bee stings and medications can also cause serious reactions. Classroom tips for avoiding allergic reactions. Do not allow sharing of food. Fruit and veggies are generally a safe, healthy snack. Students that consume a food that a classmate is allergic to should wash their hands and wipe down their desks. All food that is brought in for class parties must be checked by a nurse. Always double-check ingredients for foods entering the classroom. Encourage parents to provide an alternative snack for students with allergies and try to avoid using allergens in your lessons. Notify parents or your nurse with any questions. How are you affected by the delegate law? All school functions, including athletics, after-school activities such as clubs, field trips, require that there must be a delegate present to administer epinephrine in the event of a life-threatening emergency. A list of all students participating in all before and after school clubs must be provided to the nurse. For any activity occurring on or off school grounds during or outside of regular school hours that is organized by the school, a 2-week notice must be given with a list of students attending the event. This will provide sufficient time needed to determine if the student with an allergy is attending the trip or event, and a nurse or designee is assigned to accompany the student on the trip. All staff members should be aware of any students under the care that may require administration of epinephrine. Please make sure that substitutes are aware of any students with allergies and be prepared to take action. So what happens during an allergic reaction? Our immune system attacks a food or specific substance in a food. Blood vessels swell, smooth muscles such as lungs and bronchioles contract, and the person may experience redness, swelling, and itchy skin. Signs of a severe allergic reaction or anaphylaxis include difficulty breathing, swelling of the tongue, swelling or tightness in the throat, difficulty talking or hoarse voice, wheezing, persistent cough, persistent dizziness, or collapse. Pale and floppy, and this may be seen mainly in younger children. Mild to moderate reactions include swelling of the lips, face or eyes, hives or welts, tingling in the mouth, abdominal pain, and vomiting. How can we help someone having an allergic reaction? First, we want to stay calm and breathe. Do not hesitate. Call the emergency medical response team or the nurse at extension 5503 and request the nurse an EpiPen. All EpiPens can be found in the main office. 911 must be contacted by yourself, the office, or a designated person. The student must always be transported to the emergency room after the EpiPen administration, even if symptoms subside, as the student may need a second dose of epinephrine or additional medical intervention of which you cannot perform. The delegate can only give 1 dose of epinephrine, even if you have a twin pack available for administration. These are the 2 most common types of epinephrine that students use. Another type of autoinjector, known as EpiPen Junior Pack, 0.15 milligrams, is for those students who weigh less than 66 pounds. EpiPen 0.3 milligrams is for those students who weigh over 66 pounds. Remember, although the pack has 2 injectors, as a designee or delegate, you cannot administer the second dose. The first injection buys the student 15 minutes of time, and calling 911 is imperative. How to properly administer epinephrine. When using the EpiPen, remove the cap and press firmly against the outer thigh. You will hear a click and hold it in place for 5 seconds. When using AviQ, remove the cover and follow the recorded directions. Place the black end on the outer thigh and press firmly. Hold for 5 seconds. What to do next? Massage the injection site for 5 seconds, continue monitoring the student, and the student must be transported to the hospital. Give used autoinjectors to the nurse to place in the sharps container in the health office or to EMS personnel for disposal. After hours, when the health office is closed, give the autoinjector to the EMS staff for safe disposal. Why should you become a delegate or designee? To hopefully save a life. Bloodborne pathogens. Universal precautions is defined as the treatment of all human blood and bodily fluids as if they were known to be infectious for HIV, hepatitis B, or other bloodborne pathogens. We use gloves and/or masks when needed to prevent contact with blood and other potentially infectious materials. Remember this rule of thumb. If it's wet and it's not yours, don't touch it. Proper glove removal. You want to make sure that you grasp the palm of one glove near your wrist. Carefully pull the glove off, turning it inside out. Hold the glove in the palm of the still gloved hand. Pull the glove until it comes off inside out. Always wash your hands after removing gloves and before touching any objects or surfaces. If a surface has been potentially contaminated, wash the affected area with soap and water for at least 15 to 20 seconds. Please call the custodian if you need soap in your classroom. Make sure your nurse is aware. Always wash your hands after you remove your gloves. If you have gotten any bodily fluids in your eyes, be sure to rinse for at least 5 minutes. If you have any bodily fluid mess, your custodian knows best. Please check with your physician regarding these important vaccines: pneumonia, shingles, Hep B, tetanus if longer than 10 years, flu shot. The clinic will likely be held in individual schools. Please do not hesitate to reach out to me with any questions or concerns.